Good morning, everybody, and welcome to our first meeting of 2026. May I take this opportunity, or rather lately, to wish you a very happy new year, and I hope the year goes well for everybody. The first item on the agenda will be a motion to remove the Christmas tree outside the chairman's office because it is considered unlucky, and I hope that is not going to reflect on our meeting this morning. I'm a very superstitious person. I've already been out and removed a few baubles, which has taken the process to move it forward, so hopefully luck will be on our side. Now I've done that evasive action. So you all have your agendas and your paperwork, and it's wonderful to see you all here for this meeting. We have some important business to have a look at and some reports, and we also have this morning a public question to deal with. The meeting is being held in person at County Hall, but will be streamed live as well. And has the recording started? So they will have heard about the Christmas tree, no doubt. Never mind. The fire alarm test has already actually occurred while we've been here this morning, so I don't anticipate there will be one. So if there is a fire alarm goes off, it will be very serious, and we will evacuate the building to the muster point, which is located on the main car park. So I'm going to move on to the formal agenda now, please, and that is to receive any apologies for absence or any substitutes. So thank you, Clerk.
Thank you, Chair. Apologies of absence have been received from Councillor Ian Mackey and Councillor Alison Birmingham.
And is there a substitute for Mr. Mackey, please? No. Thank you. And I'm unsure as to whether Councillor Long will be attending to present his report. He has not been very well recently. I don't see him here this morning. We haven't heard anything, but we will look at the report from his committee. And one of the clerks here this morning, she does also clerk that committee, so she'll be able to report back anything that we discuss or any questions we may have. We'll move on now to the minutes of the previous meeting, which you have on page 5 of your agenda pack. So can we just go through those, please? So with page 5, and page 6, page 7, page 8, page 9, 10, 11, 12, 13, and page 14. Now, are they a true and accurate record of that meeting, please? And can I have a seconder, please? Thank you. I've got a couple, Councillor Banbridge or Councillor White. Are we all in agreement, please, councillors, that that is a true and accurate record? Yes? So I'll sign those off a bit later on. Thank you. Declarations of interest, please, councillors. Are there any? No? Okay, can you record that, please? Thank you. So we'll move on to item 4 on our agenda, which is updates from the chairman. Now, this is going to be slightly different, but I've used my chairman's prerogative here with your permission. I would like, via Mr. Wake, to update you as a committee on the Care Quality Commission's report concerning Norfolk County Council's Care Act responsibilities, published on the 12th of December 2025. The report highlighted areas where improvements are required to ensure full compliance with the Care Act. To provide further context and outline the actions being taken in response, I've invited Ian Wake, Executive Director of Adult Services, to address this committee and share the steps Norfolk County Council is implementing to address the concerns raised in the report. This is for you to note, please. This forms part of the Chairman's update. This information provided by our Executive Director is not subject to questions or debate during this meeting. Once the update has concluded, we will then proceed on to the next item on the agenda. But I did wish to bring this to you. Okay, so over to Mr. Wake. Thank you.
Thank you, Madam Chairman. Just to remind colleagues of the background and context, the CQC inspection of local authorities is a new regime. And so I think it's fair to say that we're all learning, CQC are learning as well. They were new inspection teams. In terms of the timelines, we could have potentially been inspected any time from 2023 onwards. We were probably about 2/3 of the way through the process in terms of the local authorities that came before us and afterwards. And I think it's fair to say it's quite a drawn-out procedure. So we got our call from CQC, our notification of inspection, in January 2025, so pretty much exactly a year ago. We then had 3 weeks to submit our what's called our SAT, our self-assessment template, which is a prospectus of what we did, a significant amount of evidence, large number of what they called information returns that covered pathways and strategies, and also a data pack. We then had a presentation on our self-assessment template in May of last year to CQC and one on the data. And then inspectors reviewed all this and arrived on site to do the on-site inspection between the 1st and 3rd of July. They published a draft report in November and a final report in December of 2025. But I think the point I want to make in just letting you know that timescale is that the evidence and the data that we submitted a year ago was actually from 2023 and 2024. So this is very much a look-back exercise rather than where we necessarily are now. And in terms of the people that they spoke to, they could be referencing people's experience of care that actually predates that as well. As you are aware, as a committee, I've set out a ambitious programme of transformation improvement, and we had the first element of that at the last committee meeting. We are deep diving into that in future committee meetings, including today. But that was largely not captured in the inspection because we started that in January 2025. In terms of the overall results, as I'm sure you're aware by now, we got a required improvement. There are 4, each category is scored between 1 and 4, with 1 being inadequate, 2 being required improvement, 3 being good, and 4 being outstanding. The required improvement RI runs in terms of scoring from 38% to 62%, and we scored 56%. So we were at the very top of RI. And sadly, if we got 3 more points, we would have actually tipped into good, but there you are. Underneath the overall scoring, there are 9 domains. Of the 9 domains, we got RI in 7 and good in 2. And within each domain, there are 4 sets of scores that relate to partners, residents, processes, and staff and leaders. And on the staff and leaders, we got, out of the 9 domains, 7 were good. So one of the things that I really wanted to highlight today is that this wasn't a poor judgment on our hard-working staff within adult social care. I haven't got time to go through in detail every section of the report. That would we'd be here for 2 hours. But I'll just make a few high-level observations. The first is that I don't necessarily agree with the overall, don't necessarily disagree, sorry, with the overall rating. I've been clear from the moment I arrived that we needed to improve, and we are improving, and that's why I set out the comprehensive and ambitious programme of transformation and improvement. I think it's fair to say that we felt that the process by which they arrived at their judgment in areas left something to be desired. And I'm not unusual as a DAS in saying that. That's been said by DASs throughout this inspection regime. But as I said at the start, I think we're all learning, including CQC. Just two areas that were disappointing. So when we received the draft report, there were 121 factual inaccuracies. And we challenged quite robustly. Suzanne Baldwin did a really forensic response. And CQC accepted the majority of our challenges and actually amended the narrative in the report in response. But sadly, they didn't amend a single score, which we were disappointed about. My second observation is that the report in places is overly anecdotal. And again, this has been a complaint of DASs the country-wide as they've gone through this inspection process. So there is, in my view, an over-reliance on testimony of a very small number of residents over what I would argue are larger and more reliable data sources. And when I say that, that is not in any way to downplay or to decry or to dispute the experience of the residents that they spoke to and to suggest in any way that that wasn't genuine. But given that we commission long-term care packages for almost 40,000 people per year, I do think it's reasonable to ask whether the testimony of a very small number of residents is representative of a much larger cohort that we commission care for, particularly when our population-based data that is based on much larger samples tells a different story. And just to illustrate that, yesterday morning we received a really excellent data pack from Stacey Palmer on the benchmarking performance of Norfolk County Council. And that highlighted areas where Norfolk County Council was performing in the top 5 local authorities in its group. And 2 of the 3 for adults were on safeguarding Section 42 inquiries and on the engagement and involvement of carers. And yet they were the 2 areas where we perhaps came in for the most criticism by CQC. Having said all of that, I think it's fair, and to be fair to CQC, as I said at the start, where there are areas of the department which clearly needed improving and where we are improving. We historically have been undertaking too many assessments. We've been doing that too early. We are not as good as others at preventing demand on our front door. Staff have been working in a very transactional system, as we discussed at the last committee, and residents are waiting sometimes too long for assessments and reviews. We've lacked commissioning strategy, and historically we have had a challenged and underdeveloped care market, although again things are really improving in this area, and I'm delighted that Louise Brosnan is here to give you an update on that a bit later during this committee meeting. But in that sense, there were no huge surprises in the areas that they identified that needed improvement. I fully accept that. We've set out really detailed plans and we are working to implement those. And the transformation programme, as I say, is the answer to the concerns that CQC have set out. I would like to just reflect on some positives as well. So I was really pleased that CQC referenced our self-awareness and our needs to improve. They referenced the transformation programme itself as a model of best practice and innovation and the mechanism that will drive that improvement. Their rationale often for that not translating into more positive scores was that they felt it was not sufficiently embedded yet. And I think that's true because we're at the start of the journey. So I think that was completely reasonable. They referenced the culture change and the quality of leadership of the new department's leadership team, and that was really nice to hear that staff had universally welcomed a new and engaging and inclusive leadership approach that my new leadership team has brought. And most importantly, they referenced the quality of staff and their high levels of engagement and enthusiasm. I'll just pick up on two areas where I say certainly the media have focused on. The first is safeguarding. So we are experiencing high and increasing demand in safeguarding, as are many other local authorities. As I referenced a few minutes ago, where we undertake an inquiry, the latest data suggests that risk is reduced or removed in 93% of the inquiries completed, which is really, really good performance. The feedback or the concern raised by CQC related to the issue of feedback and the timeliness of feedback. So some care providers highlighted that when they submitted concerns, so that's the initial referral, the feedback wasn't always timely. We've really improved that in the last 12 months. So the latest data suggests that where concerns are raised that didn't progress to inquiry, feedback was provided in 87% of cases, and where concern progressed to inquiry, feedback was provided in 95% of cases. And we've also interviewed a sample of adults who have experienced a Section 42 inquiry, and most said that they felt listened to and that they were satisfied with the outcome. We've introduced a professionals portal to improve both the quality of referral information and to support more timely resources, and that portal automates feedback in a way that the previous systems didn't. And in 2023, the Council commissioned an independent review into our safeguarding processes and practices. This identified a number of areas of improvement. We've delivered that improvement, and that was confirmed in a re-inspection by the reviewer in January of 2025. Regrettably, CQC inspectors concluded because that was only January 25 that they couldn't say it had been embedded for a long enough time, and I think that they've marked us down because of that. Their other main criticism on safeguarding was that they felt sometimes people stayed in inappropriate placements for too long. Just to reassure the committee, we have really robust practice in place for individuals that need to be moved to a different placement because we're concerned about the quality of care. However, where people have capacity and CQC registration still allows, even though we may suggest and encourage that that person moves, if they are dead set in staying within that placement, that is their right to do so. And that can sometimes mean that people choose to stay in placements that we would think were not particularly appropriate. And then finally on carers, I'm really proud of the progress we've made in increasing the number of unpaid carers that we've identified and supported. We have a carer support service that operates via a social impact bond that's linked to three outcomes of increasing the number of carers identified, improving carer well-being, and sustaining carer roles. And the evidence from, or the performance evidence from that bond shows a really strong impact. So 85% of all carers still caring after a year of support reported that they received timely help and were confident in their caring. However, we do recognise that some people who spoke to CQC did not receive the support that they needed. That is a trend across England, and although national benchmarking suggests that Norfolk are in the top 5 local authorities in our comparator group for carer engagement, that carer satisfaction is still not where we would want it to be. So we recognise that we have more work to do. Finally, in terms of next steps, We need to provide some assurance back to the Department of Health and Social Care at quarterly intervals. It's pretty light touch, to be honest, and we've got our transformation programme set out, which is the answer to all of this. So that is the feedback that we will be providing. In terms of re-inspection, it's an interesting question, and the answer is we just don't know. We've been in discussions via ADAS, along with a lot of other DASs, to try and work out what that might look like in the future. And to be fair to CQC, they don't know either. We have this thing around the corner called LGR. That creates some obvious challenges. Is it right for CQC to re-inspect organisations that may not exist in a year's time? Equally, if they wait until the new councils are formed, is it going to be practical to inspect new organisations that have got no track record historically of delivery? It's certainly more challenging. Conversely, CQC's view is that with new councils and new administrations and new officers, as a regulator, they want to be assured that new organisations are set up and are on the right track. So I think it's likely to be lighter touch, and they will focus on the individual themes and the individual domains rather than undertake a full inspection. But I hope that provides the committee with some assurance that we are all over this. We have a plan to improve. That plan is the transformation programme. And I'm confident as we deliver that, if we were to be re-inspected, we will get a much more positive result. But thank you for giving me the opportunity, Chair, and I'll stop there.
Lovely, thank you. Well, I appreciate that. I'm sure our councillors do as well, because obviously we needed to have some kind of update on where we were with it. And it wasn't on our agenda when it was published, but I have used my opportunity as a chairman to use that for you. Some councillors have indicated to me, Ian, they'd like some of the data from Stacey Palmer's data. Perhaps you could circulate that. That would be very helpful. So we move on then with the agenda, and we're going to go to item 5, which is public question time. And on this occasion, we did have a public question. I don't see the gentleman here, but there is a question from a gentleman called Richard Ward. And that question and a supplementary question have received reports, and they have been published on Norfolk County Council's website and distributed to you as committee members, and will be appended to the minutes of this meeting. So, councillors, you have a copy of that, I am sure. So we'll move on then to local member issues, and we have received no local member issue questions. So that item we do not need to consider. So item 7 is a proactive intervention through population health management programme update. It is on page 15 of your agenda pack. It's a report by the Executive Director of Adult Social Care, and there is no presentation on it, so it will be straight into questions. And today we have Suzanne Meredith and Nick Clinch and Josh Robotham here to answer any of your questions or comments you might like to make. So I'm going to hand it over to the floor now. Thank you. Councillor Watkins, thank you.
It's working. Sorry, wrong microphone. Apologies. Right. Yes. Well, thank you, Chair. I broadly welcome the new population health management approach as outlined in the report, and certainly I think the evidence suggests that it's making a real difference to how Norfolk County Council support people within their own community environments. And I think already there seems to be emerging best practice in cardiovascular disease prevention, which we've seen at a national level. And I think the success of our Falls pilot, it's been going for a while now, I think provides us with the confidence that it's not only proving to be beneficial for a large number of people involved in that pilot, but it's having the positive benefit of reducing number of falls that people have, and obviously reducing the demand of packages of care being put together. Clearly, as the report suggests, a crucial part of rolling this out successfully in the future will be about listening and learning and responding in a way that delivers even greater benefits than we've seen already, and embedding the sort of proactive intervention approach even more effectively. So, as the director has already said, when sort of giving us the briefing on the CQC inspection, this is an absolutely essential part of Adult Social Care's transformation programme moving ahead. And I think from the comments that we've had before, it is an approach that I think there is a consensus. I think everybody supports that. However, it's not without a degree of risk, as most big projects, big initiatives tend to be. And I think those are adequately highlighted in paragraph 9 of the report in terms of the risks involved and detailing those. So maybe just 2 or 3 questions, if I may, Chair.
Yes, thank you.
First of all, how will the department endeavour to make sure that the process that we target, that targeted intervention reaches the people it's intended to reach, and that we're not blown off course? My second question is really the capacity issue, and whether we have the resources to be able to roll this out successfully across the county to ensure that there is a level playing field here, and that there are not areas of the county that are left at any particular disadvantage. My final question would be really the elephant in the room, which is, of course, LGR, and we don't know what's going to happen. Hopefully we will hear within the next few weeks about what the future structure is likely to be. But in terms of moving this particular approach forward in the future, if this is seen as the future for adult social care, is this something that perhaps the adult social community, social care community would embrace? So even the new councils moving forward, are they likely to sort of accept that this is the right approach moving forward? I think that's probably all I want to say. Thank you, Chair.
Lovely, thank you. Who's going to answer those? Nick? Lovely. Mr. Clinch, thank you.
Thank you. Thank you, Councillor Watkins. Really interesting questions, and I'll have a first run through them, and then Suzanne, Meredith, I'm sure will probably have some supplementary responses as well. So in terms of the work on falls, which I'll just cover, so in terms of ensuring that it targets those that most need it, so obviously we've laid out in the paper the methodology we've developed, which is using the AI tool to identify people who are at risk of falling. What that then practically converts into is we have a pool of about 12,000 people who we've identified who are at the highest risk of falling, and those are the individuals that we have teams on the ground who are then reaching out to engage with them. We're confident, based on the pilots, that that's an accurate way of identifying people who are at risk of falling, but we're not resting on our laurels in terms of we're continuously testing that, and where people don't engage, so for example we contact them, perhaps they don't pick up the telephone or isn't the right time for them to have that engagement with us, we will go back to them again. We've also got quite a clear breakdown of how that looks across the county, down to a very local neighbourhood level in terms of where people live, and we're using that to make sure again that we're reaching everyone within different communities, and it isn't just perhaps within particular urban areas or particular rural areas. Your second question about capacity, do we have the resources? On that front, yeah, so in terms of the falls, we are confident that we do. We've got essentially 2 parts to the model. the people who are directly contacting residents who we've identified at risk of falling. And there are essentially 7 different teams on the 7 current district council footprints that are doing that work. And then we have commission support from predominantly a range of voluntary sector organisations who are then supporting those individuals we engage with that, with the help that they need. For both of those, we've modelled that in quite detail to make sure that for the rollout that we're doing to 12,000 people, we have the capacity required for that. Obviously, if we then found we wanted to extend it even further to a greater range of people, that would require us to then redo our demand and capacity planning and look at that again. And then finally on LGR, so the model that I've just described is heavily engaged and co-delivered actually with most of the other local authorities within Norfolk, outside of Norfolk County Council. So a number of district, borough and city councils are actually those organisations who are directly contacting residents with us. So in that way, they're directly part of it. And then I think also the overarching model that we've built with this of being based in local communities, supporting residents to access local community assets that will reduce the chance of falling, I think fits very comfortably actually with most of the priorities of other local authorities within the county. So I think certainly from a departmental perspective, we feel quite confident that this fits with whatever will come out of LGR. I'll just pass that. I don't know, Suzanne, if there's anything you want to add around CVD.
Thank you very much. So with regard to CVD, we're working with the ICB to develop this programme because they are leading this it's within their remit. They have access to all the information about patients who have these conditions such as AF, high blood pressure and high cholesterol. And they also work very closely with GP practices, and the GP practices data is what's being used to identify these people. With regard to capacity, the ICB also have a team of population health management team that access the data, identify the people, and then contact them and invite them to access the treatment that's being offered to them. And the ICB are currently procuring extra resources to help support general practice because they realise that general practices are really busy and they sometimes don't have the extra capacity within there. So they are actually in the process of currently procuring extra resources to support general practice. And CVD is, as you've seen from the paper, is a national priority and a local priority because of its importance and the way it contributes to ill health. So I can see in the future that any other organisation that comes from LGR hopefully would recognise that too. Thank you.
Thank you. Do you have any more questions at all, Brian? No? Councillors, any more questions on this report, please? Chrissy, thank you. And then Michael.
Yeah, thank you, Chair. I noticed sort of like some organisations, like, for example, going into like community CAFs and doing blood pressure and that sort of thing, testing people's ears and that sort of thing. And they tell people then to go to the GPs. I've often wondered, with now in the world of nurse prescribers, people can't necessarily get into the GPs. I know I have enormous problems sometimes. And they can prescribe some medications, not all, but some medications. So in the world of nurse prescribers, would it be an idea to employ some that can go into these community CAFs, that test the blood pressure and everything else, you know, they can prescribe, to actually prescribe there and then, do you know what I mean? Because it's okay getting them to go to the GPs, but often or not, it's really still hard to get into the GPs. And for one reason or another, some people think, oh, I can't be bothered. Would that be a way to go, do you know what I mean, in the future?
It could be, and you're quite right that skill mix in the future is really important. And one of the other ways that the ICB are currently looking at is the use of community pharmacy as well, because the community pharmacists also have the ability to prescribe the medication too. So you're absolutely right that skill mix in the future and the way we do this, really important, and also in the community, really important too. Thank you.
Thank you. Michael, thank you.
Thank you, Chair. So my question is, what safeguards are to ensure that residents identified by this programme, or AI programme, understand why they've been contacted proactively and not feel surveillance or stigmatised because they've been contacted. Thank you.
Thank you. So in terms of the falls work, that's a really important point, and our teams have given a lot of careful thought to that, and it was something we tested quite heavily during the pilots. So the first part is that we write to residents first before they receive any kind of phone call or other interaction, and that letter will lay out quite clearly why we're contacting people. That it's optional, so if they choose that it's not the right time for them, but also it's very carefully written. Certainly around falls, there's quite a strong evidence base that if you talk about falls in that initial engagement, actually it potentially will increase the chance of falling. So essentially, we've made sure that the way we initially have that engagement with the resident describes them quite clearly why they're being contacted by us and what the support offer is. But it's up to them whether or not they wish to then engage in that. I think it's also important to recognise that all of the individuals that we're contacting will have had some form of previous engagement with either ourselves or district, borough or city council colleagues as well. So it won't be the first time that they will have heard from us, but it will be probably the first time on this particular area of focus. So we've also got a feedback mechanism that if any residents wish to provide feedback at all during any of the falls work, they can absolutely do so, and we're using that quite heavily to influence how we change the service as it goes.
Thank you.
Oh, I was going to add from the CVD perspective, is that access and links to a website that gives them a lot more information about what's going on. And those letters are very carefully written by clinicians and GPs, and there's a committee that looks at them and makes sure it signs them off in advance. There's lots of support on offer as well, and there's reassurance all the way that this is about support and guiding people through making informed choices. So there's no pressure at any point in order to do this. Thanks.
Thank you. Are there any more questions, please? No, nobody's indicating. So if I turn to page 16 of your agenda pack, you have some recommendations there. 3 recommendations. Maintain the focus on prevention as a key strategic ambition for Norfolk County Council. 2, endorse the population health management approach being implemented within adult social services. And 3, note the progress made to scale up these ambitious programmes as part of the Adult Social Services Transformation Programme. So we'll have updates brought to us throughout the year on how this is progressing anyway, along with the transformation. So can we agree those recommendations, please? Yes? Lovely, thank you very much. So thank you, officers, for responding there. We'll move on then to item 8 on the agenda, which is the quality overview of Norfolk County Council's care provision. Again, there is not a presentation on this for this item. We have Officer Louise Bronson here to answer the questions. So, councillors, are there any questions from this report, please? Thank you, Brian. Thank you.
Thank you, Chair. I think that there's no doubt that we're all aware of the huge challenges that lie ahead of us in terms of ensuring a strong and robust and diverse care market in Norfolk. But certainly the results that we've had here show that there is certainly a step in the right direction, and that's very encouraging. Clearly, we mustn't lose sight of the fact, though, that there are still too many providers that do not appear to be up to scratch, who require improvement, and obviously that can't be overlooked. I think that the old model of CQC inspection has clearly become very much outdated and unreliable in recent years. So I think it's very important, critical, that the new PAMS approach that we now have is seen to work. It's a very necessary addition to our inspection approach at the council, and hopefully it can bring about an improvement in quality and hopefully an improvement that can be sustained in the longer term. But obviously the proof of the pudding will be in the eating with that. But paragraph 3 on page 32 of the report outlines the key components of that approach in detail. I think my concern, and I would be grateful for the comments of the officers on this, would be obviously this is going to involve significant volume and by definition will be far more resource intensive. So again, in a way, it goes back to the question I was asking on the last report, whether we have the resources to be able to deal with everything. My questions are, you know, were there any particular consistent areas of weakness that applied to the 26% of providers that are deemed to require improvement, whether there's a trend there? And what are your realistic expectations for this coming year with the resources that we have available in order to bring about sort of more improvement in those providers that are struggling? Thank you.
Thank you. I think Louise is going on to that, please. Thank you.
Thank you, Councillor Watkins. Yeah, with regards to resources, just to be clear, we're not requesting additional resource in order to do this. The improvements that we've made with the existing resource within the team. So all we're asking for is for that to continue so that we can continue with our proactive approach to monitoring the quality of care, because as you mentioned, CQC inspections are much less frequent now. So our PAMS inspection ratings are much more pertinent to the quality of care currently. With regards to areas of improvement, I'm actually quite glad that you did raise that, because you may note in the report that actually in home care, it's the only area that we have seen a very small decline. We've actually seen a 0.8% decline in the quality. We've seen quite good improvements. With regards to home care, however, that is not just an issue for Norfolk. That's an issue nationally. And I've actually done a little bit of digging into some regional data, which shows actually Norfolk actually performed well with regards to home care over the last year. So other areas within the Eastern region have seen more of a decline in the quality of their home care provision than Norfolk have. So although we've seen a decline, it's not as severe as the declines that we've seen elsewhere. So we are keen to make sure we improve that, but I believe starting up a home care provision is much easier to do than starting up a care home, because you've got much less investment and much less initial investment. So unfortunately, you do get people starting home care agencies who may not have the experience that they require to deliver a quality of care that we would be satisfied with. So I think that answers all your questions, but please let me know if there's anything else. Thank you.
Thank you. I have Councillor Stuart Clancy next. Thank you.
Thank you, Chair. I think, again, I concur with much of what, well, in fact, all of what Councillor Watkins addressed. And I was refreshed to hear Louise's response to that, because I think it dealt with most of the question I was going to ask. I think overall, I think the transformation project will address a lot of these issues, which is encouraging. I also think, you know, streamlining with the emphasis on quality, the emphasis on rigour, the emphasis on training, the emphasis on, most importantly, accountability, is absolutely vital to improve the care market. But I think based on Mr Wake's presentation at the start of this meeting and this report, I genuinely believe we are heading in the right direction. I'm also pleased, again, to hear Louise's response, because the home care market, I would strongly suggest, is the one we need to home in on, is the one which needs addressing. Again, I'll declare a slight interest. I'm very much involved with that personally currently. And I will be actually providing the director with some notes of my response from start to finish of that process. Frankly, a lot of it doesn't work. And I'm pleased that you acknowledge there is areas for improvement in that area. And I think this is very, very important. Why I think it's particularly important is because we've all pursued the ethos of independence matters. That is really important. And I think most people, most caring families, most friends, families like to keep a loved one, if that loved one can be, and that loved one wishes to, remain in their own home, and to keep that degree of independence. And I think it's absolutely important that there's a coordinated and professional approach to achieving that. And I'm really encouraged to hear Louise's response. The figures, again, I've been very honest and straightforward. The figures doesn't surprise me that there's a slight decline in that market, because there is a need to address some fundamentals. We have some good people in that market, some good people, for want of a better word, at the coalface doing the job on a daily basis. But unfortunately, most of the failings are management. And it's not management, anybody in this room, it's management, and I think somebody said, Louise or Ian said, it's much easier to get into this market than it is to address the residential care. And I think this is where we need the rigour, because this is ultimately better outcomes for everybody who's involved, better outcomes first and foremost for the client, the customer, the loved one. Secondly, bottom line is, let's be honest, if you get it right, there's better financial outcomes, and frankly, you can do a lot more for less. So I think this is absolutely right to focus in on this area, and absolutely right to focus in on delivery. But again, I must summarise that I am encouraged we are moving in the right direction. Thank you, Chairman.
Thank you. I'm just going to make a comment of my own here, because my late father received home care a while ago now, but I do hope the training of the staff has improved in regards to home care, because I think this is one issue that we need to be on our toes with providers, is that the staff are adequately trained and also that they're adequately briefed. And I speak from experience here of having home care for my father, who'd had a hip replacement, and they needed to roll him. So they rolled him onto his hip replacement. Now, if I'm a nurse and you don't do that, because you risk a dislocation. So I took umbrage at that with them, and they didn't like it, but I still did it. But it was because I felt they hadn't been trained appropriately on how to manage. And I do hope from that period of time, it's a while ago now, but things have significantly improved in terms of care plan, and also in terms of training of staff on how to not exactly nurse, but how to manage some of these clients that have particularly joint replacements. So that's the comment I would make. It's not worthy of a response from an officer, but it is a comment. I move on. I have next, I have Brenda, thank you. Oh, sorry, Mr. Wake, did you wish to come in? Thank you. And
Thank you.
I've got
Just
Alison.
to respond to both of those comments, I wholeheartedly agree with all of them. On the comments Councillor Clancy has rightly made, for me, it's almost always comes down to leadership within the providers. And if you get the leadership and you get the management right, then that follows. We are investing, to come to Councillor Gurney, to the Chair's comments, we are investing heavily in programmes to develop our private sector provider leadership and management as part of a holistic quality offer. I think the final observation I'd make is we need ultimately fewer providers and longer term strategic relationships with high quality providers. We have our principal provider model in home care. It's not fully implemented yet. We are rolling that out to the remaining locality in South Norwich at the moment and over the coming months. I think that as a I'll ignore that as a strategic commissioning approach will help improve the situation as we develop those longer term strategic relationships. And there's some really exciting things coming down the track once you start to work in that way. We want to delegate more health tasks to those providers, so you rationalise the number of people going into someone's home, and you develop much longer care relationships with those providers. So, and we want to embed reopenment more further into those principal providers, again, to provide a much more holistic and integrated model. So we do have exciting plans in the transformation to address and improve home care. Thank you.
Thank you. I'm sorry about the drilling. We're going to try and find out if we can get it deferred. I was anticipating they might be mending that rather large pothole that's occurring on the County Hall entrance, but c'est la vie. Alison and then Brenda, thank you.
Thank you for indulging me, because this is in relation to carers. And I just wanted to say on a practical level, I'm 250 miles away from my dad who's receiving home care. I've got an app which tells me exactly what's happened to him during the day or what hasn't happened, which sometimes can be a good and a bad thing. He often wonders how I know that he only ate a quarter of his sandwich. But what I wanted to take this opportunity to say to families who might be listening, or to the media who might be listening, that if there is an issue, or if you have come across a sticky situation with your family member and the care agency or the carer, please make contact with the care agency in the first instance. Because I, for example, raised an issue the other day because I read that my father was in the dark, had no lights on. Now, that is a recipe for disaster when you need a walking stick and your mobility is hugely reduced. When we talk about proactive intervention to falls, well, having a light on is a pretty key point. But of course, my father had declined to put the light on. So I then spoke to the care agency and said, can you please ensure that they leave a light on, actually whether he chooses to have one on or not, but at least the light going up the stairs. That has changed his care planning. I have also spoken to him and said, this isn't something that's safe. So I would say to people, please engage with your care agency, because they were very pleased to hear from me and actually said, we welcome the fact that you've given us this feedback, because had we not known, we wouldn't have been able to then put an additional action on his care record, because it was a visitor who'd highlighted the fact that he was sitting in the dark. So I just thought that's a very practical application of how you can engage. And if you engage with those small issues, then if you have a bigger issue that's more challenging, then you've got a relationship with that care agency already, because, you know, family members are the ones that are really seeing what's going on and what's not going on. Thank you for indulging.
That's fine. I think that's very important to obviously have a good relation, not only with the carers, the family, but also with the care provider. And I think that is obviously the first port of call for any concerns. Brenda, thank you.
Thank you, Sheila. I do know that people work hard, and I do know that people want to be fairly optimistic in their outlook, but I'm not happy with the drop in home care ratings, and I'm not happy that one of the explanations given is, well, we might not be good, but there's a lot of people worse than us, which is really what I seem to hear. I don't think that's good. I know that a lot of the times, and in conversations with officers, I'm told that one of the problems is management and that they can't get good managers. Well, good managers cost and require treatment, and high quality costs. And this sort of homeopathic approach of we can do more with less just doesn't work within the care market. So, I mean, it might just be because I'm feeling rough and a bit irritable now, but I'm not happy with that answer, that there are people who are worse than us. So, hey, we're doing all right. It might be that I've taken that incorrectly, but that was what I heard. I did hear other good things, but I heard that, and that's not acceptable. Thank you.
Thank you. Who might like to respond? Thank you.
Just to say, I completely agree with you. I don't think it's because you're feeling unwell. I completely agree with you, because I'm not satisfied with it either. And if that's how the message come across, and I apologise for that because we're not satisfied with it either. I think what I was trying to say is that it's an issue that we're all facing, so we're well aware that this is a national issue and it's something we will be focusing on because we are not satisfied. We're not satisfied with the 26% of our providers that are still rated as requires improvement. So I think what our paper is trying to say is we're not satisfied, we're not where we want to be, but we're heading in the right direction. It was a good time to provide you an update because I think historically we've actually performed one of the lower performers in the region, and actually now we're mid-ranking. And again, I'm not satisfied with that. I want Norfolk County Council to be at the top of our region. I want to be the top of our family group. I want us to perform well nationally. So I completely agree with you. I'm not satisfied with a 0.8% decline either. So thank you.
Ian, thank you.
Thank you, Madam Chairman. I entirely endorse what Louise has just said. Yeah, we have huge ambitions in this department for our residents and for our care providers. And in terms of the money, I have to deliver the best outcomes for our residents on the money that politicians give us. Is it enough? I'd say no. Ideally, I'd like to be in a position to pay providers much more, such that they could pay their staff much more. But we don't get the funding from government that we need to do that. But I would just make the point: it's not always just about money. So within the money and within the fees and the framework we have some outstanding providers. So it does demonstrate that you can provide outstanding care on the fees that we pay, and actually comparatively our fees are pretty generous compared to other local authorities. But yeah, would I like more money to pay providers more? And yeah, do I think care staff are underpaid? Absolutely I do. Yeah, maybe in the future that will change.
Thank you. I've got Councillor Clancy, and then I'll come to Chrissy. Thank you.
Yeah, I think I just also endorse the comments of Louise and Mr. Wake. It is about management and leadership, and you actually can do more for less if your management and leadership are well motivated and well managed themselves, well trained and are professional and care. It can be done. How I know that? Because I'm a fellow of 2 institutes of leadership and management, and that has been the failing in the past. We're now moving into a new era where I, for one, would have confidence in the management and the leadership team in Norfolk County Council to actually, in this department, to actually deliver that very necessary change which we all want and desire. And I think we're moving in the right direction. But it can't all be done on computers. It can't be all done on flow charts, bar charts and all those kind of stuff. It happens, and it's got to happen out there on the ground. Managers has got to receive the necessary training, education and support and they've got to actually care about doing their job, and they've got to have accountability to ensure that accountability delivers what every single person in this room desires. And I genuinely believe there is a commitment to do that. And I think this committee, the portfolio holder, will hold the management to account to ensure that's done, because we're all singing from the same sheet, the team here, the members, to ensure that we have the absolute best outcomes for the recipients of this service. And management techniques, good quality management techniques, can actually deliver more for less. And I've seen that recently myself, how I could have delivered a better service and it would have cost less, genuinely.
Thank you. I think one of the other things we've got to consider is the rurality of our county as well, because in some respects, I'm not saying we're unique, because there are other counties of a similar nature, but I think that fact that we are so vast and spread out in some respects does make a lot of difference to the way in which we organise ourselves and how we achieve the outcomes. Chrissy, thank you.
I think I'd sort of like to thinking about the actual contract itself, because practically everywhere you go nowadays, you know, it's working with private companies, And sometimes their main concern is shareholders. And some of them do not work in a very ethical way. And some of them, quite frankly, don't treat their staff very well either. I'm not saying all, I'm saying some. What have we learned from bad companies and good companies? How do we actually get a contract out? Do we look at, is this because I find like sort of in care homes, for example, it gets sold off to one care home, then a multinational takes over it, and things, you know, are cut, you know, and people aren't happy. If people aren't happy, then they don't work well, you know. And working for the NHS for a few years, I had to go to, you know, to some people's homes when they're being looked after by people. And quite frankly, you know, the cost cutting to make sure the shareholders get their share was dreadful. You know, someone was being washed with J-cloths, for goodness sake, once. Do you know what I mean? And, you know, it's terrible. And I just think how much, when we're looking at a contract, how much control of that contract do we have? And what do we actually look at? Do we look at, because obviously if you've got to take shareholders and people like that into consideration, it means that extra bit of money going away as well out of your contract, you know what I mean? It just sometimes privatisation doesn't work, you know what I mean? Because we're not working with companies, like sometimes you have cooperative care places in other parts of England. It's not unusual, and they have to work very ethical. And I just wondered about that. You know, it just concerns me sometimes with people being in their homes and not necessarily having family to look after them and look after their rights.
I'm just going to make a comment on that because many years ago, I've been doing adult social services for a long time, but many years ago we had a committee and we split into councillor groups and we went off with the quality control officers here, home care, and we went and did some visits to care providers and companies. I remember going to in Norwich, in the city, because we all moved out of our safe catchment areas. I was obviously a Broadland councillor in district terms, so we all moved around one. I went off with a chap called Terry, who worked here at the time. Some of you might remember him. And we also visited some of the people that were being provided with care, which was arranged. But one of the things we noticed and noted, and I think we did significantly improve, was the way in which the workers were looked after, because some of them had only got one set of uniform. This was appalling that we were visiting people who'd only one set of uniform, and then if they wanted any more uniform, they had to pay for it themselves. So if you had your set of clean uniform on and it got covered in something, you'd got nothing else to change into unless you'd forked out and bought your own. We also talked about the fact that many years ago I did home care and we didn't have a mobile phone, and yet mobile phones were available. And if you wanted a phone, you bought one of your own and tried to claim the money back for the call. Things have changed a lot since then for work provision and for safeguarding workers, and also training and education. And I think that's been down to a consistent pressure from Norfolk County Council in particular on our providers to make sure that those people that are employed are treated very, very well. And certainly I'm sure we will hear that that is one of the considerations that we take on board when we engage any new company. So I'll hand over. But they're my comments. I'm talking about 10, 15 years ago now, because I've been here a long while, as you probably will all know. So I hope things have changed. And in fact, I'm reassured by the meetings that we always have when we ask about this, that things have changed and moved forward for the best. But I'd like to hear that again. Thank you.
Thank you, Councillor. Just to reiterate, we do have a much more rigorous approach to monitoring since the implementation of the PAMS system, which not just the Eastern region use now, but there's over 50 authorities across the country that actually have purchased that monitoring system now. It's very thorough. It actually looks at more than a CQC inspector would look at when they go in, so it's really thorough. And it does look at a lot of things around staff welfare, training, whether staff are treated appropriately. But one of the things I think we've also tried to tighten up on is who we issue contracts to in the first place. So being much more rigorous about our initial checks, because once we've taken the provider on, it's much more difficult to address those issues. So being much more rigorous about who we take on as a provider. But also I think one of the things that we've done is we speak to our CQC colleagues quite frequently with regards to their level of rigour when they allow these agencies to set up, because once they've set up to some degree, it's out of our control. It's in our control whether we offer them a contract, but that provider can still operate and deliver direct payments, private contracts to individuals. So I think we need to continue to pressure our CQC colleagues to also be much more rigorous about who they allow to set up as a care provider, so that we're not then having to retrospectively deal with those quality issues. With regards to the money question which came up previously, it's actually quite interesting. If you look at who pays higher in the region, it's not doesn't necessarily link to quality. Some of the authorities that pay much lower fees actually have a high quality. So sometimes it is just about relationships, the rigour of our approach to improvements, and the supportiveness of those visits as well, because I think it's really important we don't just go into providers and say these are your issues, you need to resolve them. These are the issues, let's resolve these issues together. And I think having that approach will all achieve much better outcomes than just leaving that to the provider to resolve. We need to work in partnership to make the improvements that are required.
Thank you. I think that's a very assuring response. As I said earlier, I sincerely hope things have progressed. In fact, I've got a friend who's working for a care agency now, and she discusses things with me, and I can tell from what she's saying that things certainly have moved forward leaps and bounds, and that's good, and it should be. It should be, because we must value them, because care work, as I have done, is not easy. It's hard work. It's very hard work. And it can be very emotional at times, and so I think you have to be a very special person to want to do it. And I know there are a lot of very, very special people in Norfolk who do it, and we're very thankful for that. So I'm not going to take any more questions. The report was to note. I think we've had quite a healthy debate and discussion. So I'm going to move forward now on to item 9, which is the update from, I'm afraid, not the chair of Norfolk County-wide Community Partnership, because obviously he's not been able to come and visit us this morning. You have a report there. This committee that Councillor Long chairs has been allocated to feed into this scrutiny process. I do believe he came and saw you in September. I wasn't chairing that meeting. I was not available, but I know Councillor Clancy Stewart did that for us. So are there any questions or any issues from that report you would wish to raise, please? Brian, thank you.
Thank you, Chair. There was reference made in that report to the Safer Norfolk campaign, which I understand has just been launched, and I would just be interested if we could hear of ways that perhaps councillors can help to support and promote the aims of that campaign moving forward. So I'd be interested to hear any suggestions of how we can help to do that. Thank you.
Thank you. Do we have an officer here? Do you want to respond? My committee clerk, Becky Tighe, was clerking that meeting. She's just going to refer. If not, what we'll do, Brian, is we'll get you a written response to your question. But if you'd like to just hold on for a moment. Okay. Thank you. Thank you.
Yeah, thank you, Chair. Thank you, Councillor Watkins. So, yeah, obviously what we can do, the Community Safety Partnership sub-panel is meeting on Monday. And if you'd like that to be taken forward, and obviously I can make sure that's raised at that meeting. On the forward plan for the panel, they are going to be looking at the progress against the specific reports that they've got, because the forward plan wasn't published in the minutes, but for members' reference. The panel are going to be considering domestic homicide reviews and domestic abuse-related death reviews, fraud, and the Winter of Action initiative to tackle retail crime, antisocial behaviour and offences linked to the nighttime economy. So they've got those 3 reports. The Safer Norfolk plan obviously feeds into all of those elements, and they reflect on that through those reports as they bring them to the panel. So I hope that's of use. If you'd like me to take that forward to the panel, I'd be very happy to do so, Councillor.
Thank you. Yes, if my comments could be taken forward, I'd be grateful. Thank you.
Thank you. Councillor Stuart Clancy. Thank you.
Thank you, Chair. Just an observation, really, on this particular panel. It's very, very, I suppose the word is cross-cutting. It encompasses virtually every other department portfolio holder within the organisation. And it produces some, shall we say, interesting work. But my observation was, how does this deliver acumen? How does this, what is it measured against? And what are the outcomes? I mean, I would strongly suggest probably there's nobody in the room who could actually answer that, because I think a lot of the work, looking at what they do, is covered within portfolio holder decisions, select committees, and other strategies throughout the council. Bottom line is, it concerns me, is this just a talk shop?
Right, I think Becky is going to try and respond to some of that. I do remember we had a great deal of perhaps on which committee should own it, because it does seem to encompass a very large range of different topics and headers that could apply to lots of different cabinet members across the whole of our committee structure here, and it finally landed with me and this committee to find it a suitable place, and I welcome the comments that are being made. So I don't know if Becky, you could respond to that, please. Thank you.
Yeah, thank you, Councillor. So the panel itself is actually a statutory scrutiny function. So it is like this committee, it's a scrutiny panel that's there specifically to look at the community safety partnership and the outcomes of that partnership. So it's looking at that wide breadth and depth of activity that the Community Safety Partnership undertake, which clearly, as Councillor Clancy has said, is cross-cutting across all different directorates within County Council and also at a district level. So the panel is comprised of members of Norfolk County Council, and there are representatives from each of the districts that sits on that as one body that looks at that in one full view. So like this committee, it's a scrutiny function. It is there to ask for information, to consider what that work programme looks like, hold that work to account and consider if the actions that are being laid out by those overarching community safety plans are being delivered by the Community Safety Partnership. It currently comes to this committee because within Norfolk County Council that responsibility falls under public health, and obviously the remit of this committee is the Adult Social Care and Public Health Select Committee, which is why it reports back into this meeting as a function of informing this committee and fulfilling that governance process. So that's the remit of the committee, that's what it's there to do. I would say that the conversations are really good and do, as we would see in select committees here, do obviously challenge and consider the data and the information in the report to a good level, and do effectively scrutinise that work from what I've seen in my supporting the panel. So hopefully that helps.
Thank you. Well, thank you for that. I think, Councillor Thomas, Alison, thank you.
Thank you. Totally off the record in a way. I used to chair this committee. And of course, it's a partnership committee, so it's not a committee that the County Council has, whilst we service the committee through public health, it's actually scrutinising the work of the Office of the Police and Crime in ensuring that the Community Safety Partnership works properly. So whilst it's county councillors are members of it, they are only part of the membership. The membership is also driven, as Becky has quite rightly said, by members from the district authorities as well. So it's a partnership scrutiny that is kind of effectively housed within the county council, because it needs to sit somewhere, and there needs to be obviously the secretariat for that committee. So I hope that helps a little bit. And when I've sat on it, it's always been, we've always had very robust conversations and challenges, and actually it is an incredibly interesting partnership meeting if you want to go along, because they do talk about a very wide-ranging scope of topics, as you can see from what's coming up next Monday.
Thank you. And actually, Becky Ty's just offered to put together a paper for information purposes that can be circulated, if you'd like it, to this panel on roles, responsibilities, and also on, obviously, the accountability and the process of it, and for it as well. So we're targeting to do and achieve, because, frankly and honestly, I don't see that in here. It's not in there. It's a lovely, interesting report, but there's no baseline information. The previous two reports, we've had baseline information. We know where we're effectively commencing from, and we know where we want to finish. Frankly, this report doesn't say that at all. Well, hopefully we'll get some more information, and that you can perhaps take on board those requests and put that into the paper, the report you produce for us. That would be wonderful. Thank you. Right, any more questions on this report, please? No? Okay, thank you. Well, this is the last item on our agenda this morning. Item number 10 is the Forward Work Programme. You have that for information. It has been collated, obviously, out of meetings that we had initially last year. We met and we discussed the topics we wanted to have a look at, plus feed in from our cabinet members and the cabinet and officers to keep us informed of what is going on. So I don't know if you've got any questions about the Forward Work Programme, please. Yes, Brenda, thank you. Councillor Jones, thank you.
Thanks, Sheila. I hope this is the right place to ask this, but I'm wondering if I could ask about some clarity on the timeline when the Promoting Independence strategy will make it through scrutiny channels. I know it's part of the Constitution now, so it won't get to committees first, but it would be really good to know what the timeline will look like and when it will appear on relevant agendas.
Thank you.
Thank you.
Nick, are you able to answer any of that for me, please?
Thank you. Yeah, so I think on the forward plan at the moment, under proposed agenda items to be considered, is adult social services strategy, which picks up your point. We need to identify which would be the appropriate date for that within the committee forward plan. So perhaps, Becky, between myself and you, we can take that away and come up with a date. Thank you.
Thank you. I'm going to ask Becky now. She's going to update us and give us some information in relation to the Forward Work Programme.
Thank you, Chair. So just to draw members' attention to an error that I've made, and I apologise for. The committee isn't proposed to bring you an oral health report in March and July. The report will be available for members' consideration in July meeting only. So the March assumption there'll be an oral health report is not the case, and I apologise if you thought that that was going to be a good thing. The report will be July's meeting only. And if I can also just draw attention to paragraph 1.2 and 1.3 of the paper, the committee previously requested, as part of the early work programming, a report on the adult skills budget, which I think was back in July of last year. I've spoken with officer colleagues. The delivery and work to support the adult skills budget doesn't fall under either the adult social care or the public health departments. So the proposal in the recommendations for your consideration is to for this committee to ask the Children, Families and Communities Select Committee to consider that item as part of their forward work programme, which is the appropriate place for that to be picked up, but equally make sure that that request from yourselves as a committee is followed through and considered at the appropriate forum. So just to highlight that to members. Thank you, Chair.
Yeah, and the other comment I would make is about oral health. It's not going to be a discussion about dentistry provision in Norfolk, because that's something that's in the remit of the, I think, one of the health and wellbeing, Fran, isn't it? It's one of your, and it's a HOSC. Yeah. Yes, well, unfortunately, you'll have to remove your dentures for that one. No, I'm sorry, I shouldn't have said that. No. Tony and I are great friends, and I'm sure he will understand that joke. Sorry, thank you. No, I do apologise, Councillor Adams. We'll discuss that when we have a coffee morning. Thank you. On a more serious note, folks, there is a recommendation on page 48, of which Becky has already alluded to, bullet point number 2. So we agree the forward work programme for the Select Committee, and then we ask Children's, Families and the Community Select Committee to consider adding on to the forward work programme the adult skills budget. Are we happy with that? Yes, thank you. Did anybody else want to say anything before I close the meeting? I'm sorry I've been such a comedian this morning. I shall have to calm myself down. I mustn't eat marmalade for breakfast. There's too much sugar in it. Anyway, thank you very much for the debate this morning. It's been delightful and constructive yet again. Thank you for the etiquette with the councillors and staff. It's been wonderful. And I'd like to close the meeting. Thank you very much.
Thank you, Chair.
Thank you.